Leonard L. Berry, Management Lessons from Mayo Clinic, inside one of the world's most admired service organizations. Dive into the world of Mayo Clinic, one of the world's most admired service organizations, through this summary of Management Lessons from Mayo Clinic by Leonard L. Berry. Experience a comprehensive analysis of the core values and practices that have shaped this medical juggernaut, from its establishment in the late 1800s to its modern-day evolution. Learn about the 3 foundational big ideas: prioritizing patient interests, promoting collaborative talent, and providing time-condensed efficiency, and the unique organizational culture that fuels Mayo's relentless pursuit of excellence. This summary will offer invaluable lessons, strategies, and insights that can be adapted to other service organizations and enhance their effectiveness.
Mayo Clinic, the world's medical Mecca. Mayo Clinic, the world's first non-profit medical group practice, is renowned for providing clear, authoritative answers to patients and their families. Dr. William Worrell Mayo founded the medical office in Rochester, Minnesota, in the late 1800s. His sons continued the vision, values, and focus on infrastructure and corporate culture. By 1914, when the practice took the name Mayo Clinic, its quality care reputation had spread, relying on word-of-mouth marketing. The clinic grew by absorbing other hospitals in Rochester and expanded to Florida and Arizona. All 3 locations, as a single organization, focus on the same priorities, resulting in more than 520,000 registrations in 2007 and revenue of $7.3 billion. Great service organizations focus on delivering promised performance, and Mayo Clinic's success speaks for itself. Mayo Clinic's 3 shields. Mayo Clinic's commitment to quality medical care is represented through its 3 shields, focusing on patients' well-being, research, and medical education. Mayo Clinic, including its medical school, boasts ongoing projects and 80% of physicians actively involved in research, enhancing its mission towards providing the best clinical medicine. Mayo Clinic's Transferable Lessons for Service Organizations. Mayo Clinic's successful operational structure provides key insights for service organizations, highlighting the importance of a strategy-driven approach rather than a rigid structure. The similarities between service businesses and Mayo Clinic include delivering an intangible service, the need for skilled labor, flexible resource deployment, and varied customer preferences and requirements. Customer-focused scheduling and coordination are crucial, especially in industries with urgent service demands and uneven distributions. Mayo Clinic sets a unique example of designing a specialized operations strategy to meet specific service objectives, rather than haphazardly following a preconceived structure. Mayo Clinic's Art of Excellence. Mayo Clinic is a renowned healthcare organization that combines engineering and artistry to create an exceptional service culture. By merging this culture with quality strategies, efficient management, and thoughtful systems, Mayo Clinic delivers top-notch services with a focus on patients' needs. The foundation of this service culture is mutual respect, teamwork, trust, listening, inclusion, teammate contribution, and fair treatment. Mayo Clinic's enduring commitment to excellence has built its reputation in the healthcare industry. The Mayo Clinic's mission-driven approach. Mayo Clinic's success is based on 3 main principles: putting patients first, uniting their staff's talents, and providing efficient medical care. Their staff is hired not just for their current abilities but also for their potential. The culture of collaboration and development helps retain quality staff members for the long term. This mission-driven approach sets Mayo Clinic apart, attracting and retaining employees, and ultimately ensuring top-notch care for their patients. Mayo Clinic's patient-first approach. Mayo Clinic's success stems from prioritizing the needs of its patients. This philosophy is ingrained in the entire community of stakeholders ranging from physicians, healthcare professionals, board members, social workers, administrators to staff members. Every aspect of Mayo's operations is driven by a patient-first mindset, including scheduling, architecture, and employee empowerment. This approach means that any staff member can consult a superior to address a patient's needs, and Mayo staffers go the extra mile to make patients comfortable. Even new clinics joining the Mayo health system are expected to adopt this core value. The Mayo Clinic's patient-centered philosophy. Mayo Clinic's team-based approach to medical care involves a collaboration of physicians, nurses, dietitians, physical rehab specialists, social workers, and other medical staff. With a focus on patient-centered care, Mayo Clinic coordinates treatment plans through the patient's first Mayo physician, consulting with primary care doctors in the patient's hometown. The employees at Mayo Clinic work in a respectful and supportive team environment, where everyone's contributions are honored and recognized. Unlike some other healthcare facilities, there are no financial incentives for physicians to keep patients within their spectrum of care. This creates a patient-first approach, where the patient's needs are the primary concern. Mayo Clinic's structure supports their philosophy, and staff members receive salaries rather than incentive-based payments. With a strong emphasis on brand reassurance, Mayo Clinic's approach to medical care ensures the functionality of its team-based approach, giving patients the peace of mind they need in their medical treatment. Mayo Clinic's one-bucket philosophy. Mayo Clinic's centralized structure prioritizes patient care and medical education and research. With 2,500 physicians on staff, all top management roles are held by MDs, creating a peer relationship between physicians and executive leaders. This allows physician leaders to rotate into executive roles while maintaining their connections with patients and colleagues. New administrators must adapt to work with their physician peers to ensure Mayo's continued success in providing definitive answers to patients. Mayo Clinic, efficiently condensed medical care. Mayo Clinic's destination medicine strategy provides patients with integrated, efficient, and comprehensive medical care, reducing stress, travel time, and cost. This strategy eliminates lag times found in other medical models, allowing patients to complete a sequence of exams and visits within a thoughtfully scheduled week that might take weeks or months in other medical systems. Mayo Clinic adopted a new, integrated system of records and a mechanical system that helped move physical records to the next exam location before patients arrived. By the 1990s, Mayo migrated to electronic records and improved how it schedules appointments by establishing a centralized appointment desk, CAD, and integrating the CAD process with a computing system that draws on rules to identify the best sequence of appointments for each particular patient. Mayo's systems and procedures team optimizes efficiency and balances capacity and demand to ensure seamless service delivery. Perception is everything. Consumers are detectives who rely on 3 types of clues to inform their service experience. These include functional, mechanic, and humanic clues. Functional clues relate to technical aspects of the service, while mechanic clues relate to sensory experiences. Humanic clues are provided by employees and include appearance, behavior, and body language. By understanding and optimizing these clues, brands can enhance their customers' experience and perception of the brand. Mayo Clinic recognizes the importance of these clues in shaping patient experiences and takes a comprehensive approach to create a positive brand perception. Achieving success through consistent execution. Mayo Clinic's success story is not an accident, but a result of their unwavering commitment to executing their vision. At the core of this success is their culture of respect, which prioritizes excellence as a journey and aligns the organization's structure with its brand. They challenge every employee to achieve high standards, resulting in an internally motivated workforce that delivers quality care. By focusing on these lessons, your service organization can thrive as well.
In conclusion, the success of Mayo Clinic is rooted in its unwavering commitment to patient-centered care and teamwork, as well as maintaining a culture of respect and collaboration. By prioritizing patient interests, utilizing its collective talent, and providing time-condensed efficiency, Mayo Clinic has solidified its place as a globally renowned healthcare provider. As a service organization, Mayo Clinic provides vital lessons for businesses, demonstrating the importance of having a clear mission, nurturing a supportive work environment, and optimizing structure and resource allocation to deliver the highest quality service possible. By understanding and implementing these values and strategies, other service organizations can work towards achieving a similar level of success as Mayo Clinic.